All right, this gentleman needs some help. I see a shoulder imbalance right away. Look at that.
Mhm.
Boom. We can also see this foot here is averted, which means a rotated femur. What are you seeing, Rain? What's going on over
I
there?
see that, and I see a incredibly strong head forward posture.
Ooh. Oh yeah. Now this looks brutal right here.
Does
This
look
looks
brutal.
this looks brutal because look at this. Look at this
A
crease right.
lot of work. I feel like this guy rides a bicycle. Is he a bicyclist by chance? Cyclist?
I don't know.
I only say that because he's got really strong calves. He has kind of a limber middle bit, and then a really strong neck position, which I've worked with some people who do a sport, where they have to look up while they're exercising.
Right.
And I only say that because he doesn't look unhealthy. His muscle tone's not bad. I'd just be more curious about how he got himself in this position. He's a swayback, durr, with a
You know,
rotating.
I was wondering about that because based on the line, it's a sway back, but he's not, it doesn't look rounded in front like a normal sway back.
He's an anterior pelvic tilt swayback,
Mm,
which is actually,
I
well,
see.
it's not bad.
I
It's
see.
just sometimes people don't actually know that's it. And traditionally that's followed by a twist.
Mm,
Because we know, as we saw on the feet, something is happening different in the hips. So
right.
his hips are out of balance and his pelvis is in front, like the sway back position.
Way
And
in front.
instead of the posterior pelvic tilt, he has some tone, but it's out of balance. Hence, I was wondering, like, does he do something one-sided? I don't know. There's something interesting. And then if you look at the right arm, it's just sort of hanging off his body. It's kind of dripping off, where the left has a little bit more integrity. The rotation is doing that, right? You observed the right foot went out, the right
Yeah.
arm is kind of droopy.
So this gentleman has reported that he has sciatica.
On the right side.
Yeah.
Yes.
He didn't say what side, but he
Oh,
says pain around my pelvis and groin that feels like I'm permanently about to strain my groin.
yes. This makes
Mm.
sense.
And he says, I have general unhappiness that my body is twisted and
Mm-hmm.
gives me pain in the lower back, but it's
Mm-hmm.
more about how I look and then how it makes me feel.
Ooh, okay. I have a good one for him. Because doesn't it just look like if someone grabbed his ears and pulled him straight up to the sky, he might stretch out and kind of find his way?
Yeah.
Okay, and if you're not a good visual, I have a helping hand.
I mean, it makes sense why he has sciatica nerve pain, you know? That pelvis is way
The
out
pelvis
front.
is twisted, really way out front. So the only thing holding this gentleman up are his calves, which you can see they're well developed, but the strength around the femur, the hamstring, the quad, right? Those are good. We've got nice tone. It's the only thing holding him up on the world, right? Because you showed us in his picture, he's way forward. So his low back, his anterior pelvic tilt, his calves, all of these things are holding him up, and the neck. But everything in between is twisted and just compensating and kind of floating in the wind.
Yeah. Do you have, can we go inside the body? Can you share something
Yeah,
on your
let's
end?
do it.
By the way, just for folks listening, this that photo in the top right was not straight. So we always encourage everyone to do their best to get the best picture that they can so that we can evaluate them.
It's so great. I mean, I have to admit, it was a little challenging. I was like, oh, so I just pushed that everyone share button. Can you see my screen?
I cannot.
Darn. One more time. Share screen. Dun, dun, dun. Can you
Okay.
see it
Got
now?
it. Got it.
All right. I love this picture. What do you see? I'm going to ask you, doctor. What do you see?
I see. It's way back.
Very good.
way out in front.
Yeah, and this guy actually looks pretty good just in bones, right?
Yeah.
Watch this. We can get him better. We can get him worse. Okay, this is our guy.
Yeah. And that's my neck too, by the way. So
This is many people who computer.
yep.
This is many
Always like
computer or
this.
neckers.
Always like this.
Always like this. And again, guys, like why? We've talked about your hips, we've talked about your head. When the body doesn't work as a whole unit, like even here, I'm sitting on the floor, I'm having this conversation with you. When I move in towards my computer screen, I have two choices. I can do the chicken, which is that guy, or I can train my body to think, here's my head, which we're going to see with this little gentleman. My hips are below. And when I move forward towards my computer, my hips must participate. And that's when you think of like, you know, bowing, Chinese tea ceremony, how it's very ritualistic, right? There's a composure, even if the floor, you're on the floor, but the hips need to follow the head.
Right.
Now, if the head does that, the hips do nothing but like twist and get stuck.
Right.
So this little guy, I love this guy, but this is essentially what you do.
We need to name him. We'll name him soon.
Maybe let's have a contest. Let's let the guys out there name him. Yeah, he kind of reminds me of the Michelin Man's baby.
Okay.
Remember the big tire guy from Ghostbusters?
Yeah.
I could be showing my age. I love this though, guys. See, this is what we look at when Kevin draws that line. Here, see? Shoulder imbalance. If the shoulders are imbalanced, they went too far. The triangles will be imbalanced. So I want to go back to this guy. Just watch him for a minute. Pushed head upward and move ears away. So that's the bad posture. That's the good posture.
Right.
Bad posture, good posture, bad posture. Okay, I want to do that one more time.
And go figure, this gentleman is reporting a lot of crunching and clicking in his neck.
Oh.
And we can not only will posture help him with that, but getting him on the nutritional protocol will help him with that to get that calcium and
Absolutely.
magnesium going.
Yeah, let's just look at that picture for a minute. That's our gentleman right there. There he is.
Yep.
And if people are like, the only thing our gentleman has is, you see here, this one, this skeleton doesn't have as an anterior tilt as our client showing himself, which is why there's not that extra excessiveness right here. But this will get excessive when this gets excessive.
Right.
Everything is connected. So when I say this joint is the only one that's on the right line, so that means this joint, the ankle, is taking the burden for so much stability. And this motion, and I keep talking about the head, but I know we don't always think the head's important, but you've seen in your book, you've seen there's even a name for it. It's called tech neck. We didn't have that in PT 30 years ago. And it's all this heavy head. And then here, the foot. It's all connected, guys.
Mm-hmm.
So I love that little guy because little squiggy there.
Maybe that's his name, Lil Swiggy.
Little Swiggy.
Sounds like a rapper.
I just watched Rhythm and Flow, so I got a little of the hip hop in the brain. Stop share.
All right. Well, the bottom line is this gentleman is in pain. He's in his early 40s, and we can get him corrected, and we can get him corrected quite quickly. He just
he has the tone.
Yeah.
He like he'd be one of those gentlemen that we would even just say, like, go stand against the wall. Tell us what you feel. And I mean, I'm really hoping he'll be like, wow, how come my head doesn't touch the wall? And we'll be like, exactly, because little Squiggy needs to pull your head up. But little Squiggy is really our own internal self.
Yeah, and we could do a little sway back with posture guy too. You know, kind of like this.
Yeah.
Way
and
out
now,
front.
Yeah. But and that was different for you. Remember, you're like, how come the guy's not all turtled? Because he took the anterior tilt with him, which means he's a little bit stronger than the posterior person.
I
That's all.
guess I guess I'm so used to seeing swayback with posterior
Hmm.
pelvic tilt, which kind of makes that whole rounding motion.
Hmm. Well, when you've got a posterior pelvic tilt, you really know the person is walking with their inner thighs. When you see a little bit of what this gentleman presents, which is a little bit of a sway back with the anterior, and then you were really good at pointing out his hips were in balance. One was more anterior per se than the other. All that means is it's out of balance,
Yeah.
right? It's out of balance. So one of those hips is the driver hip. One of those hips is the kickstand kind of standing hip. And everybody at home can kind of feel that if you safely stand somewhere, close your eyes, walk in place, open your eyes, and observe, did you kind of end up looking in one direction?
Yeah.
And if you do, tell us what happened and I'll tell you why. I'm not giving it all away today, but that's a great self-test to find out who your driver leg is.
Absolutely. So, yeah, if anyone else is interested in a P-Ray, go to peaceoverpain.com and submit.